Welcome to Be Less Stupid. I'm your host, Jon Hotchkiss. I'm here at the Bernie Sanders rally in Long Beach, California. I'm trying to find out how much people really know about Medicare for All.
I am here tonight for several reasons. I'm here to ask for your help to win the Democratic primary in the great state of California.
After impeaching Donald Trump, Medicare for All is perhaps the most important issue that Democrats are struggling with this election season. The question I have is, how much do people really know about Medicare for All? And what's the difference between, say, Medicare for All and, well, a public option or your private insurance or single payer? I think that the Democrats have done a pretty terrible job of explaining how health insurance plans that they are proposing are going to be different than what they have right now. And what they have right now is an incredibly complicated series of payments. You have to have co-payments. There are deductibles. Can you see a doctor in your own group or organization? What are the costs of your premiums every month? Then what are your deductibles? How much are you going to have to pay for drugs? How much are you going to have to pay for medications? How much are you going to have to pay for hospital stays? What if you have something that's really bad? These are all questions that I think that Democrats are struggling with, and that our candidates have done a pretty bad job of walking us through step by step. I'm going to talk to some Democrats here today and ask them how much they really know about the proposal of Medicare for All. I just would like to know, could you explain Medicare for All for me?
Medicare for All?
No, Medicare for All. It's the big thing that the Democratic candidates are running on. And for the life of me, I think they're doing a terrible job explaining it to us. And so I want to know if you know what it is.
At the rate that the only thing that I know so far is that they want to start dipping into it and taking a lot of taking money out of.
A lot of people I know are concerned about this Medicare for All thing. A lot of people are saying, well, if we all have Medicare, then why are people going to work union jobs? Because, you know, they negotiated our contracts.
You pay into it through your payroll payments, and then when you qualify, so if everybody has a Medicare, everyone would qualify, it's a nominal amount compared to what you would pay a regular insurance company.
So, but do I make a co-payment to my doctor after I visit them under Bernie's plan?
I'm not sure with regular Medicare, it's what Medicare covers, and you're responsible for the remainder unless you choose to purchase a secondary
so that costs me money.
Policy.
Right, because now
but
we pay
not necessarily.
Okay, but
so I'd like to answer that in a very clear yes. Okay, so if you think about all your co-pays and deductibles that you were talking about earlier, that's a private tax that you're already paying. So that's money that people are already spending that's not going back into the economy.
I'm a liberal guy, but I am confused, I think, like lots of voters. I don't understand Medicare for All. Do you?
I thought we had Medicare for All.
You think you have it right now?
Yeah.
Can you explain to me anything about Medicare for All? Will I have to pay a copay every month?
I guess that depends on what comes out of the legislation. Who's going to be able to predict that?
So could you explain what Medicare for All will be?
So my understanding of Medicare for All is that we would have comprehensive coverage for all U.S. citizens for their medical, dental, vision.
Who pays for my insurance, for my medicine and doctor's visits? How is that managed? Do I write a check to the government every month? Does my employer send a check? How's that work?
My understanding is that you take the employer out, which would help in allowing people the opportunity to pursue whatever career path they want without consideration of what they're going like having to keep their jobs so that they can keep their medical insurance.
Could you explain anything about Medicare for All?
Yes, it's single payer health care. It's the only morally conscionable option because it covers everybody.
So at the moment, the way I get health insurance is through my job. My employer pays some portion of a premium.
Right.
Then I have a supplemental premium, and then when I go see my doctor, I have a co-payment, and depending on if he's or she is in my network, I have to pay more or less, depending. And then if they write a prescription, for the generic drug I pay less, for a regular drug I pay more.
Right.
So what's going to happen, for example, who's going to pay when I, under the new program that the Democrats are proposing?
Federal government.
So wait, they're going to literally send the check to the doctors,
Yeah.
But who am I going to send money to get covered?
You're not going to send it to anybody, you're going to pay taxes.
So I don't have to pay an additional thing on top of my taxes.
You're going to have, well, the tax rates will have to go up.
This is comprehensive health care, which says no more premiums, no more deductibles, no more out-of-pocket expenses. People in this country who are 60, 62, who have no health insurance or inadequate health insurance, who are desperately trying to get into Medicare, wait till they're 65. We are going to lower that age to 55 first year, 45 second year, 35 third year, and then we cover every man, woman, and child with comprehensive health care.
Thank you for watching part 1 of Be Less Stupid series on Medicare for All. You can see part 2, where I'm going to reveal a whole bunch of pretty bad things that the Democrats are not telling us about Medicare for All. You can see that right now. I'm going to leave a link down in the description. For Be Less Stupid, I'm the host, Jon Hotchkiss. And as a reminder, if you enjoy the content on this channel, would you please subscribe and leave a comment? And also, if you don't mind, tell a friend. Thank you all very much, and I will see you next time on Be Less Stupid.